Attention body workers or birth professionals, low back pain is a very common complaint that most moms have after birth, especially right-sided low back pain. So if you'll stay tuned, I'm going to teach you 2 techniques that you can do for moms to help get them out of pain and have them singing your praises. Hi everyone, my name is Lynn Schulte. I'm a women's health physical therapist in the Denver and Boulder, Colorado area, and I am the founder of the Institute for Birth Healing. And today we're going to be talking about low back pain, specifically right-sided low back pain, and actually how to treat it. So this video is actually for body workers or birth professionals who can do hands-on treatments on moms. And the reason I'm sharing this technique, or these 2 techniques that you need to help moms get out of pain, is that I'm getting emails from women all over the world who are finding my videos on my YouTube channel, the Institute for Birth Healing, and they're emailing me and saying, oh my gosh, I have exactly what you're talking about. Do you know someone in my area who can help me? And I feel so bad because I don't, not yet anyway. It's my hope and my dream that the Institute for Birth Healing will have practitioners who have taken our courses and will be certified in birth healing all over the world. And that way I will be able to say, yes, go check out this person here. They'll know it. And so until that happens, this is the most common complaint that moms have, is this low back pain. And these 2 techniques are famous for just getting moms out of pain. And so I thought I would put this video out there in hopes that birth professionals or body workers would learn these 2 simple techniques and start applying them to moms so moms can get out of pain. That's my real impetus for doing this. And secondarily, I would hope that that would spur practitioners on to learning more, because this is just one small piece of the puzzle in helping moms heal more completely after birth. And so my holistic treatment for the postpartum body course is a 3-day hands-on training where you learn a ton of techniques to help moms get their bodies back after birth. So the most common complaint, though, that women come to me for is this low back pain, and specifically that back pain tends to be more on the right side. So I'm sharing these techniques with you today, but I want you to realize that there should be no pain involved when you go to apply them to your mom. So if it's creating pain and moms are wincing and they're saying, ow, you're not doing the techniques correctly. So please stop. There may, typically what moms say is, oh my gosh, that feels so good. Yes, it's a little tender, but oh, you're right on there. So they absolutely love when, at least my moms love when I do this technique to them. So that's why I want to helpfully share this, get this in your hands so that you can have the same success. And then moms are going to be singing your praises and referring more women your way. So the first thing we need to talk about, and I've covered this in more detail in my other videos, so please check it out if you're not familiar with the common birth pattern. Now, with the common birth pattern, we have this right side sacrum actually gets jammed up and it gets pushed over to this side. Okay, so the sacrum moves over to the right hand side and it jams up in this right SI joint. And so that's the problem we're having in there. And so to assess this issue, there's 2 things you want to look at. One is the levelness of the sacral base. So are the base of the sacrum, are they sitting level in the body? So I'll have moms lay down, they're supine, they're on their back, and I will slide my hands underneath here and find the sacral base on either side. And typically what I find is the right side will be more up towards their head than the left side. And so that's the first sign that, oh, they might be in that pattern. The second sign is that we're going to mobilize the sacrum and see how it moves in the sacroiliac joint. And typically with the common birth pattern, you're going to find that the right side will not move as freely as the left side. So I will bring both of my fingers over here on the inside of the PSI PSIS, and I'll get into the sacral sulcus here, but I make sure I'm not in the middle of the sacrum, but I'm off to right in on the right hand side. And so I slide my other hand underneath there. This hand is between their legs, and I'm going to show you this on a client here. But both of my hands come together to one side, and then we're going to do a PA, so a posterior to anterior pressure where we're pushing up on that sacrum toward the ceiling, and then seeing how that sacrum moves. Does it move? A lot of times it'll be like the whole body will move, but you won't feel it in the joint. And then we're going to come over onto this left side, find the left PSIS, and come in and make sure you're up by the base and that you're not down here on the sacrum doing this, but that you're right by that PSIS, and you're just going to push directly up toward the ceiling and compare the mobility side to side. And if you notice that the right side does not move as freely and that it is a little bit higher, they're definitely in that common birth pattern. And these two techniques that I'm going to show you are exactly what you need to do to treat it. So I'll show you this on a client, but before we do so, I'll just explain what we're going to do. So we'll slide our hand between the legs and underneath the sacrum, and we're going to find this spot right here, and again, right in here. And then we're going to have this hand come in from the side, and we're going to push right up into the sacral sulcus on that right hand side. We're going to push up toward the ceiling, and then we're going to pull down towards their feet. So the motion is kind of an up and then a swoop down. So we're pulling that sacrum down, and then we're pushing up on it. And that's one step. The second step is where, so the sacrum actually gets pushed off to this right hand side. And so what we're going to do is mom's laying on her back. We're going to stand on her left hand side, and we're going to slide her hand, or our hand, underneath her sacrum and find this lower third here. And so we want to find this part of her lower sacrum, and we need to pull it toward the midline. So we're going to pull this towards us, and we're going to anchor on this top part. So we can be on this lateral side of that pubic bone. This can be tender, so be very careful with your placement, your hand placement here. I've also found that putting my hand on their ilium offers that same kind of traction that we're wanting. So we need to push the ilium away while we pull the sacrum towards us. And that helps to get this sacrum in the midline again, because when we assess, we're going to find that the sacrum is more off on that right hand side. So stay tuned, and I'm going to show you what this looks like actually on a patient. Okay. So there's two steps that we need to do to treat the sacrum out and get it out of its common birth pattern. And the first step, so what we're going to be doing here on the pelvis is, remember, the sacrum is jammed up on this right hand side here. So we're going to slide our hand underneath our patients, and we're going to find that right side between the PSIS and the midline of the sacrum. So our fingers are going to come right into here, and we're going to just encourage the sacrum to come down towards their feet. So what that looks like, I'm going to have you hold this for me if you don't mind. What that looks like, go ahead and straighten out your legs there, is we're going to slide our hand underneath their sacrum, and we're going to find the PSIS on that right side, and we're going to find the sacral sulcus on that right side. And go ahead and roll on over so that they can see where my fingers are. So I'm here. So I think we have marked, yep, we have marked here. There's the PSIS is marked. So my hands are right on the inside of that. And so go ahead and so both fingers are right in that sacral sulcus, right, but inside of the PSIS. So go ahead and roll back on over. And what we're going to do is we're going to push up toward the ceiling, and then we're going to encourage that to come down towards her feet. So the motion is pushing up and then pulling down. So that's just the first part of the treatment. The second part of the treatment is we need to encourage this sacrum to get back to midline. Remember, it got shifted over to the side. So the sacrum is off to the right-hand side. And so what we're going to do is find the lateral border of that sacral lower third part of the sacrum. And we're going to have our other hand on the pelvis, and we're going to push and pull, okay? So the lower hand is going to pull towards you. The upper hand, you can try either putting it on the pubic bone or the ilium to counter that pushing or pulling of the sacrum. So we slide our hand underneath and then go, I'm right on that lower edge. Go ahead and roll on over so people can see. There's my finger. I'm right on the lower edge of her sacrum right here, okay? So this is where I'm pulling from, this direction. Go ahead and roll back on over. My other hand is going to go either on the side of the pubic bone here. I've also found that being on the side of the ilium can offer a counter pressure there. So my lower hand is pulling towards me. My upper hand is pushing away from me. This helps to get the sacrum in the midline again. So when you palpate it, you may notice that the sacrum is off to the right-hand side. We want it directly below that pubic bone. And so pulling that sacrum towards you and pushing the pubic bone away will help realign that sacrum into midline and help get out of that common birth pattern with the sacrum. Now there's other things that we need to work on in the pelvis to help it get out of the common birth pattern, and I cover more of those in my holistic treatment of the postpartum body course. But so many women are complaining of low back pain after pregnancy, especially right-sided low back pain. And these two simple little techniques can help them, relieve them of so much pain and discomfort. So I hope that you can give this a try. It should not cause pain, right, Mara?
It feels great.
A lot of times they'll say, "Oh my God, that feels so good." It doesn't hurt, but it's like, oh, it creates a little pressure, right?
Sensation,
but it's not pain, okay?
No.
If it's creating pain, you're not doing it correctly, so stop. Avoid all pain, but you're just encouraging that sacrum to get back into its proper position without pain. And you should be able to appreciate a difference in the mobility of those joints afterwards. So you can, before you do the treatment, actually come in here and find the inside PSIS on the right side and push directly up toward the ceiling and see how the right side moves. And then you come on into the left side and go on the inside of the PSIS on the sacrum and push up, and they should move evenly. And with the postpartum pattern, you'll find that the right side doesn't move as easily. So you do that before you do the treatment, and that tells you whether or not there is a dysfunction going on in there. And then you go ahead and do the treatment of pushing up toward the ceiling, pulling down toward the feet in the same, it's kind of a swoop. So it's up and down at the same time, and then the moving the sacrum over to the left and countering with the opposite hand pushing away. So I hope that helps. If you're interested in learning more about my holistic treatment for the postpartum body course, please check it out. I've got the link below this video. All right, take care and good luck.